Uh, Good morning, good afternoon, and good evening to everyone. My name is Jonathan Crush, and I'm the host of the second webinar in a new series from the Migration Food Security Project, or MiFOOD, of the Hungry Cities Partnership, funded by the Social Science and Humanities Research Council of Canada. We've got a large audience today of 50 plus registrants from around the world, and I'm pleased to welcome everyone to the Balsillie School of International Affairs in Waterloo, Ontario, Canada, which is the convener of the webinar series. I'm also honored to virtually welcome back to Canada, our home country, and the Balsillie School, our distinguished speaker for the day, Dr. Marie Rule from the International Food Policy Research Institute, or IFPRI, the leading global food policy think tank and a partner organization in the MiFOOD project. Marie is director of the Poverty, Health and Nutrition Division at IFPRI and an international thought leader in research and advocacy for equitable and sustainable policies and programs to alleviate poverty, malnutrition, and food insecurity in low and middle income countries. In recognition of her stellar contribution, Marie was awarded the Kellogg Prize for Lifetime Achievement in Nutrition in 2019. There's simply no one better qualified than Marie to speak on the subject of today's webinar, measuring food security in the time of COVID-19. While the definition and measurement of food security are subject of long-standing debate, their relevance has been heightened by recent shocks to the globalized food system from the COVID-19 pandemic and the knock-on effects of the Russian invasion of Ukraine, and not to mention the impact of other entrenched conflicts around the world. I'll ask Marie to speak for about 20 minutes to her PowerPoint, after which we'll have about 15 or 20 minutes for comments and questions. I'd ask you to use the Q&A function to post these during Marie's presentation, and I'll return to pose them to her on your behalf during the discussion period. So Marie, again, a very warm welcome, and over to you.
Thank you so much. I will share my screen. So hello, everyone, and thanks for joining. It's a real pleasure for me to be here and to share with you some reflections on the issue of measuring food security in the time of COVID-19 pandemic. So as you know, food security has been very high on the agenda recently for governments as well as for the international development community. We have seen how the pandemic and the government measures, especially to control the pandemic, have resulted in losses of jobs and income, has caused some value chain disruptions and food price volatility, and has caused a global economic recession. And of course, in the background, we continue to have the climate change and extreme weather shocks that continue to destroy crops, livelihoods, and exacerbate poverty and food insecurity. And now we have the Russia-Ukraine crisis, which presents unique threats to food security. In all of this, we have seen that the poor and marginalized are disproportionately affected, and we need to be able to find them and track progress in providing support to them in terms of food security maintenance. So what I thought I would do today was to reflect quickly on what we have learned about food insecurity during the pandemic, not so much provide results, but provide results that illustrate how food security has been measured, what indicators and metrics and approaches have been used, what are the strengths and limitations of these approaches, and of the information generated, and then give a brief overview of some of the existing resources that we have to select metrics and indicators to measure different aspects of food security at different levels. So starting with the global level, I will go pretty fast with these results. Really, the point here is to, as I said, highlight the indicators that are used. So we have this indicator, which is the number or the percentage of undernourished in the world that you probably all are very familiar with. It is tracked every year since 2005 in the global report from FAO and other UN agency, the state of food insecurity in the world. And you can see from the last report that the spike in terms of the percentage of the population and the percentage and the number of people that have been undernourished as a result of the first year of the pandemic, it really shows a spike. And this indicator reflects the number of people that do not have enough calories, do not have enough food. So this is a large number, and about 10%, it corresponds to about 10% of the population. So the indicator did respond to what was going on and shows definitely a deterioration. It also allows us to understand that more than half of the people that are undernourished live in Asia and a third in Africa. So those are useful. This is useful global information about the nature of this part of the problem or this type of food insecurity. The SOPHI report now also, since 2014, has been using the food insecurity experience scale, which is an experience-based indicator, which is useful in terms of informing about the severity of the perceived food insecurity at the household or individual level, and can be categorized in severe food insecurity, the red bar here, and moderate food insecurity. So this indicator is a simple indicator. It uses 8 questions, and it is providing information both on quantity and quality, whether people worry about having enough food, but also if they worry about having the right types of food, having a high quality foods. And so we can see again, this indicator has gone up significantly at the level of the world, in Africa, quite a bit, and in Latin America as well, and as well as in Asia. So it is showing that globally there really is a problem and that food insecurity is worsening. I also wanted to highlight a new indicator that has been included in the SOPHI report since 2020. But the results are not during the pandemic. They are for 2000. The latest SOPHI presents results for a change between 2017 and 19. It doesn't include the time of the crisis. But the reason to show it is because I think it is a very useful indicator that gives us some information about one of the access issue of food security. One of the biggest issue related to people not having access to a healthy diet is the cost. And here, this indicator has identified that 3 billion people cannot afford a healthy diet. And that was before the crisis, with percentages of up to 80% of the population in Africa and 44% in Asia. That report did not include impacts on of the crisis of the pandemic, but it does cite some work that was done by IFPRI using some modeling approaches and with a data set of 63 countries that showed that there predicted an additional 141 million people who could not afford a healthy diet in 2020. So again, this is a useful approach to looking at food security at the global level, having more information about an access issue, very severe access issue, and also considering not just having access to enough food, but to a healthy diet. Now, in terms of modeling, I also just wanted to show some of the modeling that IFPRI has done. We will focus on the right-hand side here, that looked with their modeling using Mirabaud models, What is the predicted level of reduction in consumption of nutrient-rich foods? Again, what COVID has showed is that people just could not afford these healthier foods. And here you can see that the prediction of their reduction in consumption in terms of fruit, vegetable, fish, meat, and dairy is what was mostly affected. And they increased their consumption of oil and sugar to get more calories. Surprisingly, they also reduced a little bit their consumption, or the prediction was that they would predict to some extent also their consumption of cereals. So again, other aspects of the crisis that show a very severe problem. Here I wanted to talk very briefly about our phone surveys, because at F3 we do a lot of surveys and data collection. And of course, during the crisis, we could not do data collection in person, so we relied on phone surveys. And phone surveys were better than nothing, really, but were really not providing the same level of detail that we can have when we actually interview people in person. We had to limit the phone surveys to about 15-20 minutes. You can't keep people on a phone for an hour or two like we do sometimes in person. And so we couldn't go through the usual detailed income and expenditure modules, for example, or detailed information on their consumption. So here, the kind of information that we got, for example, was that income declined. We don't know by how much, but half of the population among the poorest in this sample in Addis Ababa, half of them reported a decline in their income, and it was worse for the poorest than the other two income tertiles. And those people are richer, but they're not rich. It was really a sample of poor urban dwellers, and the poorest suffered more. The same when you look at their consumption of dairy products, an example of a nutritious food. And you look at before and after, that is before and during, that is January and February, the green bar for 2020, and May 2020 at the peak of the restrictions and et cetera. And you can see that the two lower tertiles suffered more than richer people, which is not unexpected, but it did illustrate that, and it was confirmed in a number of other studies we did in other areas. I just want to point out that a lot of these phone surveys and some of the modeling also has been published in two compendium of blogs that we wrote throughout 2020 and 2022 in two books, COVID and Global Food Security in 2020, and the second one 2 years later in 2022. And I don't have time to go into the results, of course, but I just wanted to highlight a few points that, first of all, we confirmed that the crisis exacerbated inequalities in gender among the poor and of course, among the informal sector. And that was consistent everywhere we looked and in all of the surveys we did. Urban populations were generally hit harder in terms of losing income and jobs, but also in terms of food insecurity. And this is not very surprising because they have to purchase all of their food. Most of them have to purchase their food, whereas in rural areas, they can rely on their own consumption. And I will skip the other 2 points because I'm afraid that the presentation will be too long. But have a look if you're interested in seeing some of the results from these past 2 years. So now I will shift to talking more specifically about where we are with the measurement of food security and highlight some of the new ways of measuring food security that I think are very promising. So this is we use the usual FAO definition. I think this is one that has that presents all of the types of dimensions that we like to consider in a definition of food security. So I decided to use this one. And in 2015, we wrote this paper with Jeff Leroy and Ed Frangillo, where we looked at the food access, but we wanted to look at the indicators of food access and see which ones were most useful and had been validated and what we would recommend. And so we had made this graphic here, and what I want to highlight from it is that the graphic at the time was specifying different dimensions, different levels at which we collect data on food security, and also different components: quantity, quality, safety, cultural acceptability. And I just wanted to highlight that where we have made progress and where we haven't. So in terms of affordability, we have made some progress. I've showed already one approach to measure affordability. Stability, we have not improved. That is the stability through season, that people have access through the seasons to enough of the right foods. We have not improved. And on the equity, that all people are food secure, we have not improved in terms of measuring this aspect. We have improved in terms of quality. I've mentioned some already, and I will mention more. We have made quite a bit of progress in terms of food security, not just quantity, calories, but also quality of the diet. We have a very good, strong indicator of the experience of food security that I just mentioned. But we have not much in terms of safety of the food that we have access or not have access to, and cultural acceptability and preferences. So that's where I think we are with indicators. Now, I wanted to show the Data for Diets platform. Most of you may have consulted it, I've seen it, but for those of you who haven't, I just wanted to point your attention to this very useful platform, which was created by the Index project led by Tufts University. That project is now closed, but the platform is still there. And it does have a very good set of food security indicators. It lists the indicators, but it also describes them, how to measure, how to use them, how to measure them, what they're meant to do, the different dimensions and components of food security that they represent at the bottom, these quality, quantity, et cetera, and they talk about data sources and have a few case studies. So this is what it looks like when you ask for food security indicators. And what I want to point out here is that on the right side, you see that they have 28 food security indicators that supposedly represent quality, 23 that capture quantity, and there are overlaps there. 5 supposedly that represent stability, 3 sustainability, safety, and 1, etc. And then they have at what levels they can be collected, and what are the data sources. What I really wanted to point out here is that this is very good, but this is way too many indicators. I mean, they do clarify, for example, if it's an emerging indicator, not developed, not fully developed, or not fully validated, but and they're well described, and it's a good inventory of food security indicators. But I think we need to come down to more of an agreement on what should be the set of food security indicators that most of us should use for different purposes. And so take this inventory, if you want, and look down and say, well, those should be really the 5 to 10 maximum indicators that should be used at those different levels. So anyway, this is a very useful inventory anyway of food security indicators. I encourage you to look at what they have in there, and you can judge by yourself where they have validations that they refer you to the articles, and you can see which ones have been validated and which ones have not. So the food insecurity experience scale, I will skip now because of lack of time, but this is the one I was mentioning, which is very simple. It's 8 questions that have been pilot tested over and over and has been validated. So that is one indicator that can use at the global level or in surveys, and we've used it. It was quite easy to use during the pandemic. Finally, indicators of diet quality. Being a nutritionist, I've been really complaining for many, many years that food security indicators focused mostly on quantity and not quality. And so now I think we're making progress in this area. You have all heard, I'm sure, of the dietary diversity indicators for women and children. Those have been validated, and they represent the nutrient adequacy of the diet. That is, a higher number on that scale predicts that these population groups are likely to have or have a greater probability of meeting the nutrient adequacy, meaning their adequacy of micronutrient intake. And in the lower categories, they have a very low probability of meeting their nutrient adequacy. So this is a well-developed, well-validated two indicator that have been used extensively in DHS surveys, in impact evaluations. Many of you probably have used it. We have used them a lot, but I have felt that this was not enough, especially now that we have multiple forms of malnutrition, and that pretty much everywhere we work now, we have both problems of undernutrition, micronutrient deficiency, and child undernutrition, maternal undernutrition, as well as problems of overweight and obesity and risks of non-communicable diseases. So I've been feeling that we really need to have indicators that capture more than just micronutrient adequacy. So just two of those indicators, the Global Dietary Recommendation Score, GDR score, is one that has been developed by Anna Herford and team, and has 18 food groups, and some are categorized as healthy and others are categorized as less, or they lose a point because they shouldn't be consumed. And there is no quantity really. So they're either healthy or you should limit them, and they lose a point. It's been validated and showed that the results adhere or represent adherence to global dietary recommendations. This is how this was designed, taking the 11 descriptors for what constitutes a healthy diet, and mapping the questions to those types of food groups and saying this one is we should limit, so therefore we lose a point, or fruit and vegetable in quantity gains a point, etc. It has been validated, but it only predicts the adherence to the global dietary recommendations in the sense of preventing obesity and non-communicable diseases. It doesn't predict nutrient adequacy. So in places where we have still a lot of undernutrition and micronutrient deficiencies and child malnutrition, undernutrition, this is not such a good indicator. But it is being used in the Gallup polls, so data are being collected on this indicator, so it will be useful for prediction of obesity and non-communicable diseases. There are plans to scale up into 100 countries, so this is an indicator that you will hear about if you haven't already. Finally, the Global Diet Quality Score, which is my favorite by far, has 25 food groups. 16 are healthy and get a point, 7 are unhealthy, and 2 are unhealthy when the foods are consumed in high quantity. I think it's an important distinction because for me, there isn't that many foods that are unhealthy. It's just the amounts that you consume that can make them really unhealthy. But definitely high-fat dairy, for example, is not unhealthy, but if you consume too much of it, it's way too much saturated fat. And the same for red meat. And we know that there are excessive amounts of consumption of red meat in some areas of the world. And so those lose points. That indicator requires 3 levels of intake so that they can categorize whether it's low, medium, or high, and scoring goes with that. So it's a little more complex than the GDR score because of the quantity required, or at least to categorize in 3, low, medium, or high consumption. It has been validated for its ability to predict nutrient adequacy, as well as NCD or non-communicable disease risks and health outcomes. So it covers both, which, as I said, is very useful. It is new, it has been validated, but it hasn't been used much yet. And what is useful with it is that it comes with an app where you can record all of the information on the app, and it also shows pictures of the sizes, what is low, medium, or high quantity for different food groups that are in there, for the 25 food groups. So finally, a few reflections, but I want to keep time for discussion. Measuring food security is more important than ever. And more important than ever, we need simple, flexible, rapid measurements and indicators that you can compute rapidly and that you can have results produced and shared rapidly. We need to standardize indicators to allow comparability. We need to not just choose our pet indicator and that's really our job to try to provide more guidance on a subset of indicators, as I've mentioned before, so that we can compare between studies, countries, etc. We need indicators to measure different dimensions of food security. We've made progress on that, but there's still a need for other aspects of food security that are important and not well represented in any of the indicators we have. We need indicators for crisis situations, for phone surveys, or for data collection that is really simple and possibly done on the phone. And finally, we need to develop simpler tools. I mentioned that, but we have started to use digital data collection tools, which does simplify things and makes data collection a little more accurate. And our team has also started to develop an approach using artificial intelligence where you take a photograph of a meal and you get all of the information about the nutrients that are in there and what you're missing. And so there are things that we can do to greatly simplify. And I think more and more technology will help us to simplify our approaches to measuring food security and diet quality. Thank you.
Thanks so much, Marie. That was really excellent and really gave us a snapshot of the tremendous advances that IFPRI's been making in moving this field forward. If you, this is to the participants, if you have any questions, please just post them in the Q&A and I'll pose them to Marie. We do have a couple already, so let me just review these, Marie. Okay. Recently, the World Committee on Food Security has proposed 2 extra pillars for food security, agency and sustainability. So this person is interested in your view about these extra dimensions. And if you think they're warranted, how would we actually set about measuring them?
Yes, agency I had not heard about, and I really haven't thought about it. But in terms of sustainability, there is definitely a movement to try to capture it. It is work in progress. We also talk a lot about sustainable, healthy diets, and we still don't have a good definition of sustainability of sustainable diets, and also how to convince people to adopt a sustainable diet when we don't really have such a good definition. So I think those are very good points. but I don't really have an answer. I think it's very early on in terms of sustainability. And when I showed the data for diet, I think there were 3 that were mentioned there as potential indicators that capture sustainability. And I looked at them, and now I can't remember. I think they were in progress or something. I probably wasn't very convinced, because if I had been, maybe I would remember. But have a look at what they proposed there, and they may be just indicators are in progress.
Okay, thanks very much. There's a couple of other questions about metrics here. I guess this is from someone in the Hungry Cities Partnership. In the Hungry Cities Partnership and its predecessor, AFSAN, we've relied extensively on phantom measures of accessibility, such as HFIAS, HFIAP, HDDS, and MAHFP. And we're not the only ones to do so. They seem to have sort of been used quite extensively, particularly the HDDS, I guess. I'm just wondering about your general view about those phantom measures.
Yes, definitely. I actually think that those the HFIS and those experience-based indicators were precursors to the one that we're now relying on, that I've presented, the FIES. I've always gotten very confused with all these HHSFS and all that, but you know, it was household food insecurity scale and all of that, and they were different versions really of the same thing. And I think that FIES has now been validated more than others, and is used at the global level, which gives it an advantage. The household diet diversity score is actually one that I have never liked, because it was confusing nutrient-rich foods with non-rich foods. So it was an indicator of food security in the sense of how many food groups did you consume. So it gives you an idea of more or less food group. But some of those were, I think, sugar and oil, and some were not healthy food groups. And so it was purely a predictor of consumption, but consumption not qualitatively assessed. Just, you know, if you consume 3 food groups out of that list, you know that your food security is really bad. And if you consume a higher number, your food security from a quantitative point of view is better, but it didn't separate what was good and not good or qualitatively.
Okay, thanks very much, Marie. So it's a couple of questions now about COVID in relation to food security. First one is, could you please speak to the statement on one of your slides that, quote, poverty rose in the rural areas, while urban populations were hit harder by the pandemic?
Yeah, I didn't explain because I had longer than 20 minutes, so I tried to. So basically, the urban population was hit harder in terms of immediately having a hit on their consumption. So when you look at urban and rural, you can see that the reduction in consumption, in food consumption, was higher in urban versus rural areas. But at the same time, the economics, because they could compensate and consume from their own food production, and that really made a difference. But in the longer term, after 2 years, they suffered from the economic crisis, and poverty has gone up. And the urban areas have recovered probably more. They, when we look at, for example, we have data from Bangladesh where we have 6 or 7 surveys, and the last one was, and you could see that when there were lockdowns again or other measures taken, that things were going badly. But then I think the last one was January 2022, when things were a little bit more stable. You could see that people in urban areas had gone back up to the percentage who had a job and the percentage who had their income back to where it was 2 years ago. But in rural areas, they were not back to the situation before. So they suffered from the underlying economic crisis more, but the urban suffered more in the short term. The urban also may have had better coping strategies than the rural population. For the rural population, if they have to sell assets because they just are unable to fill all their consumption needs, then those will have longer term impacts on their productivity and on their livelihoods and all of that. So I think that's what is generally happening.
Okay, thanks. And the other one is, during the pandemic, there seems to have been a major global increase in online food platforms and purchasing. Do you think this is just a temporary trend? And is it likely to impact in any way on food security?
Well, we're talking about the world here. I think it's a bit like the comparison could be made with virtual work, that during the pandemic, the online purchase where possible of food and takeout and all of that really made life a lot easier for people, and also was a good measure to avoid too many people in supermarkets. And I got COVID, and I'm pretty sure I got it from the supermarket because that's the only place where I had been, and even with a mask. So, I do believe that I should have taken out a little more or ordered online a little more. I do think it's a trend that will continue, like working virtually. We've learned that it works well to just order food and it comes and you pay and it works well. It saves you time, and it's the same as virtual work. 2 years ago, we feared giving seminars virtually. Now we prefer it because we know that they're better attended and there's all these other advantages. So I think definitely it's there to stay, this new mode of purchasing. But again, this is a very modern thing. I mean, I was surprised to hear that, I can't remember in what countries I was, maybe it's Latin America, but of course in Latin America, yes, you can have food ordered and delivered. But in Africa, this is not a common phenomenon, and you will still have the vendors that may come to your house, but there wasn't such systems of online shopping and takeout and all of that. So I think every country, in the measure that they could, have made attempts to facilitate access to food, to prevent people having to meet in large crowds to acquire food. But the markets are still functioning, and I think the masks have been the solution, partial solution, but has been what people have used as a precaution. But yeah, so I think it's there to stay, and may go down a little bit. It's actually fun to go buy food, and so some people will want to go back and all of that. And as I said, it's similar to our going back to work, where people want to go back, but just 1 or 2 days. They don't want to go the whole week. We've changed a lot the way we see, how we use our time.
Yeah, that's fascinating. And I'm sorry to hear that the virus caught up with you in the supermarkets. So just sort of beg your indulgence for a couple more questions. There's two that I'm just going to pose together because they seem in some ways to be related. I'm not entirely clear what the first one is asking, but I'll pose it anyway. Can nature-based solutions contribute to increased food security? Has any research been done on the subject? And then I think this is related, perhaps. I'd be curious to hear your thoughts on the viability and potential of alternative proteins like insect protein.
Mm-hmm. Yeah, I'm not sure what nature-based solution. This might be a term that's used specifically to refer to something. I'm not sure what it means in this context here. I can answer the viable. Maybe we can get more information from the person who asked. Alternative proteins are definitely a very important potential source of protein, and especially insects. I mean, they're animals after all. They have complete protein. We know that protein are not complete in plant foods. You need to pair them properly to have the full set of amino acids, and so insects is a good idea. And the one place where I worry about alternative protein is those that are completely synthesized. I am personally, but lots of people are concerned about processing of food and the process of processing being itself detrimental, and including all sorts of products and byproducts and even non-food products to make them tasteful and have the right texture, etc. So I'm not at all fond of the plant-based hamburgers or whatever, even if it's plant-based, it becomes too processed. And so I think this is another, or synthetic proteins and all of that worry me very much. I believe in real food, not in these kinds of fabricated foods. But yeah, the alternative protein in the form of existing animal protein, it makes a lot of sense.
Okay, I think there's some clarification here. Nature-based solutions. I guess the question was, can nature-based solutions contribute to increased food security? And the questioner has said, nature-based solutions such as agroforestry or agroecology. I don't know if that helps.
Yes, definitely. And biodiversity and all of those aspects are still a little bit too much of a niche for me. I think, that there is really a lot of potential in using biodiversity and trying to protect as much as possible so that we don't deplete our resources. So definitely there is a lot of scope for these solutions to help food security, especially locally, but I think even in the larger scale.
Okay, thanks. Sort of doubling back to the COVID again, could you possibly say a bit more about why you think people in the informal sector were particularly vulnerable to the impacts of COVID? Do you have any views on how people in the informal sector can be protected from these vulnerabilities more effectively?
Yeah, the people in the informal sector that I'm thinking about are street food vendors, small restaurants, small shops, even street food processor, those that process and sell food, for example, and I'm thinking now just the informal sector in relation to food, but there are other informal sector workers. These people in general just have no job security. So if they miss work, they have no income. And this really happened very, very seriously among the poor populations we surveyed in urban areas, especially. From one day to the next, they were not able to be outside. They were not able to be in contact with other people. So the restrictions on transport and the social distancing and all of those aspect were an absolute disaster for these people that, as I said, one day not working is one day no income. And if it lasts a month, it's just very, very severe. In some countries, restrictions were actually ignored from the informal sector. I mean, there's also, the rickshaw drivers in Bangladesh that, they have no clients. Nobody's allowed to go anywhere. The country is on lockdown. So they have no income. So that's that's really the example. Those are some examples of people that have no backup. Some people in the formal sector lost jobs. I'm not saying that, everybody had a good formal, everybody in the formal sector had good jobs and nobody lost jobs, but it was more obvious devastation among those that just don't have any benefits at all or on their own. It's their own business. And how to help them was unanimously reported. I don't know if you remember in the news in Africa and even in Latin America that people were saying, we're going to die of hunger, not of COVID. If you don't let us work, we will die of hunger because we have no job. And so, a lot of people have, and governments have tried to go easier on the lockdowns and on the restrictions to allow people to work and not completely lose their income. But it was a very difficult situation to manage, and it continues to be as COVID still is with us.
Yeah, true. Thanks. Finally, Marie, this is the last question, and in a way it comes back to the core topic of your presentation. I guess it's sort of a two-part. To what extent do the indicators you mentioned capture gender-based differences? And in that context, what's your opinion of the gender equality for food security measure, the so-called GE4FS, added to the FIES scale?
Okay, I don't know that indicator, sorry. But definitely the indicators themselves don't capture, none of the indicators I've mentioned capture gender differences, and what we do at IFPRI is very, very, most of the time we collect the information at the level we interview women and collect the information separately for the household or for the male versus the female. We do have a lot of data that try to get at this issue using the same indicator of food security, but applying it to men and women and finding differences also in at the level of the informal sector for women and women. So it's not the indicator per se that has allowed us to differentiate. It's more the way we administer them to both men and women separately. But yeah, I don't know of the GE4FS. I'll look it up.
Yeah, I think it's an FAO
okay.
thing, which is, yeah, it's very new. That's true. Okay, so we've gone well over time, but thank you very much for allowing that. We've really appreciated this. Thanks so much, Marie, and look forward to continuing to engage with you. You know, it just occurred to me as you were speaking that there are advantages, obviously, to this mode, and that brought on by the pandemic, but there are clear disadvantages as well. Like I remember when you came to the school in, I think it was 2018, to give a plenary talk, and there was not only food to consume, which is impossible, and we also were able to give you a big round of applause after you've given your plenary, which is impossible here as well. I really think they should include a kind of a clap function as
Yes,
opposed
yes.
just a raise hand one. But anyway, thanks so much. Greetings to all your colleagues, and we look forward to further engagement with you.
Thank you. That was a pleasure.
Thanks, Marie. Just to let everyone know that this is a series, and we are planning to do these on a monthly basis, one a month from now on. And our next webinar, number 3 in the series, will be on Tuesday, 17th of May at the same time. Sorry, not the same time, an hour later. And it'll be a panel discussion by researchers who have been looking at the whole question of food insecurity, urbanization, and mobility in Nairobi, in Kenya. So with that, thanks very much to everybody for attending, and I hope you've found it as interesting as I have. Thank you. Goodbye.
Thank you.